This is the Money Hour with your host, Tina Mitchell, on Alternative Talk, AM 1150. Now, back to the show with local mortgage and finance expert, Tina Mitchell.
Well, welcome back to the Money Hour with your host and mortgage expert, Tina Mitchell, right here on 1150 AM KKNW, the Saturday, September 26th show. I'm here to help you build a strong financial blueprint, 1 week and one show at a time. If you're hearing my show at a different time or day, you are listening to a rebroadcast. You can call the show at 1-855-400-1150. Again, 1-855-400-1150, or online at themoneyhour.com. Again, to ask any questions to my guest, suggestions on topics, or anything regarding financing. Right now in studio, I have Sondra Earley with Mama's Associates and talking on Medicare, which it's great to have you back. Sondra, thank you.
Thank you for inviting me.
Of course. Little background. Sondra has been in the insurance and benefits business for more than 15 years, predating and postdating the Affordable Health Care Act. So she brings historical perspective as well as new news. Sondra is a licensed broker specialized in commercial and Medicare insurance. Her office is located in downtown Bellevue, and the 2016 open enrollment for Medicare begins October 15th, right around the corner, and ends December 7th, 2016. For those turning 65 and the disabled, Sondra is here not a moment too soon, and will share with us how to navigate through the Medicare Open Enrollment maze. So let's go ahead and start out with, what is Medicare? Can you break it down for my listeners?
I can break it down. It's a real valuable protection against high medical costs.
Pretty simple. You want to pay less cost in your medical expenses. That's the reason that Medicare exists. So let's go ahead and talk about the A, B, C, and D's of Medicare.
Absolutely. So being that this insurance program has 50 million beneficiaries, it's the nation's largest health insurance. So I like to teach from a very basic standpoint from A, B, and C. So let's talk about what A, B is about.
Okay.
And then we'll fill in C and D.
Perfect.
So A and B, that's the original Medicare. Part A covers the hospital insurance portion. Part B covers the medical insurance portion.
Okay.
So if we want to know a little more education, you can always go to Medicare.gov and look it up for yourself. But let's talk about the A, B, and C. C goes to Med Advantage plan, and then there is a D. D is the prescription drug plan. Outside of that, there is a plan called the supplement plan, which most people talk about as the gap, but they think they're talking about all of Medicare. That is not what it is. It's a supplement plan that does something different.
Got it. And there's a cost associated to Medicare?
There's always a cost associated with Medicare.
Can you explain that to my listeners?
Sure. If you're 65 years of age or younger with a disability, you may have worked in the United States for at least 10 years, or they call 40 quarters.
Okay.
So you've already paid for Part A. Some people think it's free, but you are paying a premium.
Mm-hmm.
Right. So Part B, that is $105.90 on average. You are always going to pay for that additional cost premium for Part B.
Got it.
If your income is much higher and there are certain levels, you may be charged more. Okay.
So really talking with you to find out where where those costs are.
Exactly.
Yes. So let's talk about what Medicare covers, Sondra.
Let's talk about what it covers. So in Part A, it's going to cover the inpatient care.
Okay.
It will cover the stay in a facility called a skilled nursing care facility, home health, and hospital care. If just a quick word about some things that it doesn't cover, deductibles. So there is a deductible associated with Part A. You will usually see that happen if you're in the hospital 1 to 60 days or longer. And those rates are always rising. So, I mean, I could give you an overview about what it is, but
Okay.
you'll pay the most if you're in hospital 1 through 60 days, and 61 through 90 days, the costs start to go down.
So, Sondra, my listeners, when should they be enrolling into a Medicare plan?
They should roll. Let's see. Let's put it this way. So when their birthday comes up, you have 3 months before the birthday,
Okay.
3 months after, and the month of your birthday. So there's a great picture. I wish I could show you where the birthday cake sits, and those 3-month periods on either side. So it's a total of 7.
Okay.
When should you learn about Medicare? I think everybody gets something in the mail when they turn 50 years of age. It's called AARP. So that's a good time to start paying
Start getting
attention.
got it.
Absolutely. But definitely, if you're 64 years of age and you're having a birthday very soon, you should start thinking about and preparing for enrolling.
To make sure that you're within that 7-month period.
That is correct.
Makes total sense. So what about your services, Sondra? What does it cost for if one of my listeners wanted to talk with you to get advice and to help through to get things set up for Medicare?
I'm a non-biased insurance agent, and I'm
Okay.
here to help you every step of the way. So there's no cost for what I do. The plan providers pay me a commission
Got it.
to actually do their marketing for them and their sales.
Sounded kind of like my position as a mortgage professional. Nobody, my clients are not paying for my services, but there is a commissions paid by the company. So
That is
similar.
correct.
Now, what about the initial consultation or appointment with you, Sondra? So no fee for that either?
No fee at all. So you're not paying me anything. If you write a check, you're going to write it to the healthcare provider, the insurance company, not to me. You can get in touch with me over the phone. I can give you over the phone consultation, one-on-one, whether that's in your home or at Starbucks or a location you're comfortable with. I also do seminars, group seminars. I try to keep it pretty small, not more than 10 people in my seminar at a time. Why? Because I like to work individually with people.
Nice.
And there's also seminars that are offered by some of the carriers, Regents, United Healthcare. I don't want to mention them all, but they do have free seminars that you can attend in local libraries, senior centers. I'd advise people to learn wherever they can.
Sure. And what about your availability?
I'm available. I'd like to say 24/7, but
you got to sleep.
I got to sleep. And beginning October 1st, I can actually talk about plans for the 2016 year.
Okay.
I cannot write an application until October the 15th.
Got it.
Okay. So I'm available by phone. You can reach me through the radio station telephone number. However, you want to talk to me over email, and I will get back to you.
And Sondra, let's talk about retiring versus keep on working. Where is your advice there?
My advice is to, if you're currently working, check in with your employer. If your employer has 20 or more employees, then make sure that you understand what the employer benefits are covering.
Okay.
If the employer has 20 or fewer than 20, you may be required to sign up for Medicare Part A and B. I'd suggest that if you are 65 or turning 65, you contact a local Social Security officer and sign up anyway for Part B, because you will be required to be enrolled in A and B before you can sign up for Medicare.
Got it. And what about additional insurance on top of Medicare? Is that, can you do that?
Well, I suppose you can. I don't advise it.
Okay.
Because, as you know, as soon as we reach the age between 55 and 60, our premiums go skyrocketing.
Yes.
So you're not going to find the same level. The premium rates are going to come down when you're on Medicare.
Okay, got it. And what about weaknesses with Medicare? If you had to come up with some of the biggest weakness, what would that be?
Well, I think the biggest weakness today is that we're not totally providing enough education for Medicare, not to our 64 plus prospects or to their children. So that's a big factor as well. So it is a maze. It is not simple. It is not easy. And it isn't free. So you have to really sit down. I suggest sitting down with a professional that can guide you through the ABCs and the maze and figure out what it costs. In terms of what is your out-of-pocket outlay, what are your premiums, and what your needs are. I always start from the needs assessment level. What is it that you really need? What are we trying to do here? Are we wed to the doctor, to the pharmacy in some cases, and what is your Medicare, what is your prescription drug plan look like? And then we take it step by step. Even if you can't afford it, there are help plans out there, low-income subsidies, Social Security programs that can help you with your Medicare medical costs.
So again, it's just sitting down again in another area with an expert and really finding out what your personal needs are, and then structuring a plan around you and what's going to best suit you. Yeah. And what about new things that are happening with Medicare? What are they?
In the cloud bubble, I would say, of ideas, we should be paying attention now to the changes, because if you currently are a Medicare enroller right now for 2015, when we start looking forward for 2016, there are changes to the plan. Some plans have fairly large networks of physicians that are in the network. Some are shrinking. So it's a good time to mark your calendar, October 15th through December 7th, to take a look at and evaluate what your plan is for 2015 and where you want to go for 2016.
So where are you seeing that people make the biggest mistakes themselves when it comes to Medicare? I mean, obviously not having, being educated, you're at risk of making some big mistakes. What do you see those are?
I think the individual should always check in with their physician as well, because the physician has to contract with Medicare, and they may be moving in and out of the network. So that's the first thing I would say. That's a consideration. Also looking at certain things about your health plan, what you know about, say, your gene code. Do you have, or do you know that you might be susceptible to high blood pressure or some other type of disease? Just taking things into consideration, having that discussion with yourself, and then going forward with your professional.
Makes total sense. Any other advice that you have for my listeners, Sondra, when it comes to Medicare?
Call early. Plan with the end in mind. And make sure that you are totally equipped as much as you can be to navigate the maze.
Makes total sense. So you heard it from Sondra. It's like all the other guests. It's all about preparation. It's about hiring and talking with an expert and determining that really you're making the best decisions for you. And again, as I said early in the show, for your family. And that's what the show's about. Sondra, thank you again for coming into studio. It's always a pleasure talking with you.
My pleasure.
And providing the wealth of information that you have for my listeners.
Thank you so much, Tina. I appreciate you.
And that's it. That's the show, you guys. Thanks for joining me. This is your mortgage expert and show host, Tina Mitchell. I'm going to sign off for the day, but I will be back next weekend, same time, same place, right here at 1150 AM KKNW. Enjoy the rest of your weekend.